Hello everyone, I am Dr. Divya Kumaraswamy, consultant gynecologist, Aster Avi Hospital. HPV is a virus that most of you must have heard about, but are often surrounded with misconceptions. So, HPV is human papilloma virus. It's a highly contagious DNA virus that affects millions of people worldwide. It spreads through intimate skin-to-skin contact and sexual contact. There are 200 different varieties of viruses have been identified, out of which some are categorized as low risk and some are categorized as high risk. The low risk ones are 6 and 11, which causes skin and mucous membrane growth. We call it as warts. While high risk varieties, there are 7 common high risk varieties I've identified, and they cause oropharyngeal cancers, anal cancers, genital cancers, which include vaginal cancer, cervical cancer, vulval cancer, and penile cancers. 80% of the sexually active adults will get exposed to HPV at one point of time. But exposure doesn't mean that you are infected. Then who are at risk of infection? Those who have an early onset sexual activity, those who have multiple partners, those who have low immunity, and those who are smokers are all at risk of infection. Even after a single exposure, one can get infected. So, what happens to those who get infected with HPV? 90% of the HPV virus is cleared from the body in first 2 years of life by the immune system. For the rest 10%, HPV persists and result in warts, precancerous condition, or cancers. High-risk HPV contributes to 5% of cancers worldwide, and more than 90% of the cervical cancers are caused by HPV. So, progression of HPV infection to cervical cancer took a long 20 years. So, we take advantage of this long year for screening for cervical cancer. So, how can you identify HPV infection? Unfortunately, HPV infection is asymptomatic unless it progressed to wart or an advanced cervical cancer. But there are methods to identify HPV infection. One is HPV testing and second is a pap test. HPV test is a test that identifies HPV DNA. This is not a blood test. Cervical secretions are collected from cervical canal and sent for testing. And this is advised for those who are above 30 years, and its screening is recommended once in 5 years. Pap test detects the presence of abnormal cervical cells, which can be due to HPV infection. Pap test is recommended for those who are above 21 years, and screening is recommended once in 3 years. So, you have done an HPV testing and the test has come negative. It's well and good. You can continue your screening once in 5 years. But what if the HPV test has come positive? Then if you have not done a pap test, you have to go for a pap test and you have to look for a cervical cytology. If the cervical cytology is negative, that means your cervical cells are not affected by HPV. It's well and good. You can repeat the HPV testing after 1 year to see if the HPV has cleared from the system. If the pap test has come positive, the pap test is positive for abnormal cervical cells, you should undergo a colposcopic guided biopsy. That is, you are visualizing your cervix under magnification and taking a biopsy from an abnormal tissue to look for any cancer cells. Is there any cure for HPV? HPV doesn't require treatment because 90% of the HPV get cleared from the system in first 2 years of life. Yes, HPV requires treatment if it has progressed to wart, precancerous, or cancer. Wart can be destroyed by different techniques. One is cryotherapy, where freezing the wart with liquid nitrogen, electrocautery, where burning the warts with electric current, laser therapy, where intense light rays are used to destroy the wart, and finally chemical burning, that is tricycloacetic acid is used to burn the wart chemically. What if you are infected with a high-risk HPV and has resulted in abnormal cervical cells and you want to preserve your uterus? Yes, you have methods available. Loop electrosurgical excision procedure, where with the help of a wire loop and electric current, we are removing an area of cervix which contains abnormal cervical cells, and that preserves your uterus. Second is a cone biopsy. A cone-shaped portion of the cervix is removed which contains an abnormal cervical cells, and after removing, it's definitely sent for testing to look for any cancer cells. Prevention is always better than cure. HPV can be prevented by following safe sex practices, and use of barrier contraception will reduce the risk of HPV. But the most important primary prevention is HPV vaccines. What does HPV vaccines do? HPV vaccines prevent a primary HPV infection and HPV related warts and cancers. HPV also prevents spread of infection between the partners. But I would like to highlight that HPV vaccine doesn't cure the infection, it's just a prevention. So when do you have to take HPV vaccine? The vaccine benefit most when it's taken before the exposure to HPV. So younger the age, better the response of vaccine. So we recommend a vaccination of young girls and boys of 11 to 12 years, but you can vaccinate as early as 9 years and can vaccinate up to 26 years. So if you are above 26, you can get vaccinated till 45 years, but with a lesser benefit because most of them will be exposed to HPV by this time. So what are the vaccines available? We have Cervarix, which protects against two high-risk varieties of HPVs, and we have quadrivalent vaccines, that is Gardasil, which protects against two low-risk varieties and two high-risk varieties. And latest Gardasil 9 is available, which protects against 7 common high-risk varieties and 2 low-risk varieties. So those who are less than 14 years, we recommend 2 doses of vaccine 6 months apart. But those who are above 14 years, additional 1 more dose, 1 month after the first dose is recommended. Should we continue the screening after vaccination? Yes, the HPV screening has to be continued after vaccination because vaccine does not protect against all strains of HPV. So common doubt is that, so should we vaccinate for those who are already infected with HPV? Yes, you can vaccinate those who are already infected with HPV. So the vaccine will give protection against the strains which they have not acquired. Protect yourself and your loved ones against HPV. Visit us at Aster RV Hospital, get yourself screened against HPV and vaccinated against HPV. Thank you.